Good evening and welcome to Inside Government for the fall 2019 semester here at Cayuga Community College. And this is a show that's broadcast on Spectrum, Verizon Fios, the Auburn Regional Media Access, better known as ARMA, as well as WDWN. I'm your host, Guy Cosentino. The Cayuga County Health Department has launched a new public health campaign this year in coordination with Auburn Community Hospital called Healthy Mom, Healthy Baby, Healthy Community to better support mothers and children in our community, not only raising awareness of their needs, but also making sure that the community is well aware of the great programs offered by the Cayuga County Health Department and to soon-to-be moms, to moms, and then their children. With us today to talk about this initiative is Kathleen Cuddy, who is the Public Health Director for the Cayuga County Health Department. She's been a guest before, as well as Maxine Kinsella, who is the Supervising Public Health Nurse for the county's Health Department. She's been with the Health Department for about 5 years. Welcome, both of you.
Thank you.
Great to have you here to talk about this program. So you did a column on this last week. I know there's been some outreach on this, but in general, what is Healthy Mom, Healthy Baby, Healthy Community?
Really, our goal with this campaign is to better support the moms and children and families of our community, not only with their health goals and reaching those, but just their overall dreams and aspirations. And the way that we hope to do that is by better linking them to the services that not only we offer at the health department, but also just with our community partners as a whole.
So how did this come about? Do we have a problem that we were looking at and said, our numbers are not good in certain areas?
That's a great question. We know in the United States that maternal mortality rates are terrible for a developed country. There are different columns and places you can seek information on that, and depending who does the rating. But as a well-developed country, we should be doing better.
So I was almost going to say stunning. So I'm a Jane Pauley fan, so I watch CBS Morning on Sunday mornings, and I cannot remember where there hasn't been, at least in the last year, one or two stories about moms and mortality rates for them.
Right. We know in 1991, the maternal mortality rate was a rate of 10.3 per 100,000 women. Fast forward to 2014, 23.8.
So what's the cause?
You know, clearly a variety of reasons, and Maxine may be able to elaborate on some of them. We think one of the best ways to help prevent maternal mortality is to get women into prenatal care and into health care providers who listen to what they need and are well skilled. Economics and insurance certainly can play a factor.
So let's take a piece of that. So, first of all, what are Cayuga County's numbers matching the federal numbers, or are we higher or lower in those mortality rates?
For premature birth, we're higher. For teen pregnancy, we're higher. Smoking rates is higher as well.
We're going to get into smoking by the end of this, because I just cannot fathom. It's been 50-something years since the Surgeon General came out with his report, and we still have smoking like we do.
Yes.
I'll get on that soapbox in a few minutes. So any idea why? I know we have high poverty rates. So we had the census people on last week. They're very concerned about census numbers, and they know the higher the poverty rate, the lower the likelihood, I'm generalizing, the returns on census information, which impacts your budget, impacts City Hall's budget with CDBG, because you get some per capita money from the federal and state governments.
Correct.
So is poverty the biggest factor there? Is it education?
Right now, they're still researching to figure out what actually is the cause. But one of the things that we do know is that women that are either Black or Hispanic do have a higher mortality rate, and that spans across different economic classes. So they don't exactly know, but one of the things that they do know is that there are different evidence-based programs that are available, and they have been able to prove over a span of about 30 or 40 years that if women are linked to certain services, that it is proven that they will be healthier, that their maternal mortality is lower, premature births are lower. Overall, they're a healthier family. And so one of the things that we want to do better is to link moms to services, because for whatever reason, it seems like we, and when I say we, I mean our country as a whole, is not doing the best job at hearing our moms and what they have to say to us as healthcare providers, and really just supporting them in general out in the community. And we know that being a mom can be very isolating in the United States, not like some other places. You know, you have a baby, you go on maternity leave, and you're home alone often with your child. So we want to offer them not only some of the evidence-based programs such as nurse-family partnership, which we have, and but also there are some mom groups in the community that are beneficial, breastfeeding groups, things like that, where there's just more of a social component. The Cayuga Community Health Network has a free doula program, which is
You got to explain that. No
huge.
acronym. Okay, so what's
Okay.
What's a
doula?
doula?
So doula is kind of like your own personal birth coach. It's a liaison between the woman that's in labor and her family and the provider. So that, for instance, would be a perfect way to kind of bridge that communication gap. And that program is available regardless of the income of the woman as well.
So you talked about Hispanics and African Americans. I don't want to get into be a data geek here, but do you have numbers about socioeconomic? Does it cross all educational and socioeconomic lines, these mortality rates, or is it among certain classifications and subclassifications?
It's among certain classifications, definitely.
So is there a stigma? Are you dealing with a stigma issue? Because you always, I know WIC, I know the program fairly well. You've been on to talk about it in the past. It's a great program.
It is.
But sometimes there's the theory that, well, that's just a government program.
Right. And I think one of the wonderful things about WIC is not only is it a prenatal and up to your child is 5 years old, it's for working families. People qualify for WIC, they may not realize it. Better nutrition gives you better health outcomes across your life.
So I know Auburn Community Hospital is involved in this. They helped kick this off during the summer. Who else? What role, first of all, are they playing in all this?
They've been very supportive in helping us to get the word out and also referring a lot of women to us over the last few months. Since we kicked off the campaign, our referrals have increased by 800%. So that has been largely due to Auburn OBGYN and our WIC program.
Since I assume the role that I'm in right now, one of the things I would like to see happen is that every woman who's pregnant connects with us through a universal referral to learn more about the programs that are available throughout the community.
So when you
but
say
what I also
universal,
want is calls after the baby's born too.
So
the
when you
feel-good
say
calls.
universal referral, what does that mean?
It means make it simple. Everybody come, one-stop shop essentially. Call the health department.
So we talk about that on economic development all the time.
Yeah.
We should be doing the same thing with health.
We should.
So we'll repeat this number several times. It's 253-1560.
Correct.
You call there, and that's part of this universal referral process, correct?
Yes.
Okay.
Yes.
So any other partners that you want to mention right off the bat before we get into some of the details of the program?
Well, I will say that we have been working several different agencies in the community under ABC Cayuga and their umbrella. And it has been our group.
So ABC Cayuga is more than just the play space
Yes.
on the corner of North and Genesee. They do
Yes.
other things as well.
Yes. They're a non-for-profit that has been around since, I believe, 2011. And they've been working to better support young families and children in our community. So we've been working under their umbrella, and just to meet, and it's several different agencies getting together and talking about what are we seeing within our own agency as challenges that are facing the families out there. So it has been the Child Advocacy Center, WIC, Cayuga Centers, various different places that are all, whoever basically works with young children and families is coming together to really band together and say, what can we do to make the situation better?
So I know you're not charging clients or people who walk in the door, but is there a cost to this program? Do you have a grant that's paying for this campaign, or is this coming out of county tax dollars?
That's great. So we actually did have some grant funds that came from the Central New York Collaborative, which was district funding from the state that helped kick off this collaborative with the idea of reducing premature birth. So that was important. But to participate in a program, it's never any cost to make a phone call, right? It's not a cost to participate. Depending on the skills that you receive, if you're in a classic maternal child health program, we would say if you have insurance, we'll bill your insurance for you. But the Cayuga County Health Department is a safety net, so we are here to serve people.
So you don't turn people away?
We turn no one away.
Okay. So you're doing this show, you're doing this flyer that we have, and people can go online, and you did, like I said, you've done columns. I know Deanna Hoy does columns, who we've had on, I know that's not her married name, but you've done public outreach that way. What other things are you doing to get the word out to the public?
We have social media, and we always encourage people to join the Cayuga County Health Department Facebook page. We do that for a number of reasons. Certainly this campaign, the Healthy Mom, Healthy Baby, Healthy Community, but it's the quickest means of communication for other health department related topics or linking people in. So we like each other's pages. We have a website. We have programs throughout the health department that people may not realize are county-sponsored programs where we reiterate this opportunity. The hospital's been a partner, all these other public health-related partners that help reiterate and reinforce this message.
So is there a dollar amount assigned to this campaign, or?
Not anymore.
Okay, all right.
But it will. We know that if we can link people into service, it's going to save money down the line.
Okay, all right. So
And
let's
if
go
I
ahead.
could add, I know that I believe it's for every dollar invested into the Nurse Family Partnership Program, there's a $7.28 or whatever it is.
Long-term savings for.
Yes, back into the community.
So let's go ahead.
Well, I think that relates to, we talk about physical health benefits, and that's clear in Healthy Mom and Healthy Baby. But healthy community goes to that economically healthy people who can interact in the community and be good neighbors to each other, who are better prepared for school. All of that leads to a healthy community.
So you sent me some trends, and before we talked on the show, you said these are local, not national and state. So if you don't mind, let's just go through and just tell me what's going on in this area. So the percentage of those who initiate breastfeeding. First of all, for those who don't know, why is it important?
I'm going to let
Ask
Maxine
the guy in the room.
Well, Maxine's a specialist in this area.
Breastfeeding is something that is very dear to my heart. I have 2 children that I breastfed for 2 years, and I just see that it is so important in shaping not only their lives, but also future generations, because the nutrition that you provide for your child as an infant affects their health in a way that will eventually affect your grandchildren's growth and development. So it truly is amazing.
And so we have, our numbers are what?
Well, I think that in Cayuga County, initiating breastfeeding is pretty good. I think at the hospital even, they start out in the 90s. But then what happens is at the 6-month mark, right around there, we see that women are discontinuing their breastfeeding relationship at that time.
So since we set up this show, not that I watch a lot of television, but occasionally I'll see something, and all the references to breastfeeding that I have seen, let's say comedy shows, Modern Family or something, have not been very positive. It's a pain, there's pumps and all this other stuff. How do you get over that social, the society just doesn't, they make fun of it?
I think that's something that we've been working on at the health department. For example, in September, we just had our 4th annual breastfeeding conference, and actually the name of that conference is Strengthening a Community. We had Dr. Jack Newman, who is known around the world, come speak, and people come to attend that from all over the state, 155 participants. And I think things like that and generating that excitement around those types of events is the first step at getting that culture change here
It doesn't happen overnight, that's for sure.
Okay.
And we've been working toward this as a goal to increase breastfeeding in our community. It's a state goal, it's a national goal. And it's talking about it. It's going to your provider and talking about it. It's seeing your friend and talking about it. And it's having resources available like certified lactation consultants who can help you. If I'm a new mom, I got a lot of help when I was at the hospital, but now I'm home and on my own. Who is going to help me? I can call the health
And I think
department.
that's where the comedy piece comes in. So how about children coming to full term? How are our numbers there?
Our numbers there are bad as well.
Okay.
I believe that
So why? So I'm not a doctor, and 99% of the people who are watching right now have no medical background, I'm assuming, unless you've just mandated everybody in the health department watch this. But why would that number be so off?
There are several things that contribute to that, and I think mainly is our high smoking rate. Poor nutrition often leads to that. History of use with alcohol or drugs affects that. There are various.
So is there a tie-in if they're not coming to full term, their birth weights are
Or lower.
Absolutely.
dramatically down? And how are we on the birth weight?
I'm
Yeah.
not sure. I think that it's pretty, like you're
Consistent.
saying,
One leads to another. So you have, you also mentioned in here employment rates, and this is just me not most likely understanding plain English, but employment rate upon graduation, and this is from the Nurse Family Partnership Program that your department runs, is it 80% from 16% on admission? What does that all mean?
So when we enroll a mother, which that program enrolls moms before their 29th week of pregnancy. So at that point, we collect data throughout this program, and 16% are employed at that point. Then with this program, their nurse is available to that mom and child and family until their child reaches 2 years of age. So then at 2 years of age, we reevaluate that again, and it goes up to 80% overall.
You know, these statistics are one of the reasons why Nurse Family Partnership is such a fantastic program, and it's one of many programs within the health department that you can get excited about public health and feel the value that it brings to our community.
So how do you, this is, I don't know when these statistics are from, but how will you judge what the success of Healthy Mom, Healthy Baby, and Healthy Community will be? Do you have benchmarks along the way?
Right now, we have developed a universal referral database that we're just collecting numbers, and we're seeing how many referrals we're receiving from which agencies, and then at that point, if we're able to connect with that mom or not, at what age of the mom are we getting that referral, and at what gestational age of the baby are we getting that, or at what point during the child's life, so that, in the future we could potentially aim to get more prenatal referrals our way instead of after the baby is born. And we're also keeping track of how many referrals we're then making back out into the community.
So let's talk about moms themselves. You're both moms. You have 3?
3 children.
And you have 2. 3 boys, 2 girls. Okay. So what's the biggest challenge for a mom going into or going through pregnancy, and then that post period? I don't want to say postpartum. Post period of the baby's here, and I may not have all the supports that I had up until everybody came to the hospital and wanted to tap on the glass.
That's right.
It's definitely a reconfiguration of your life, right? Because, as a pregnant woman, you have a certain level of hormones, then you have your baby, and those hormones dramatically drop down. You are lacking sleep, and it's a new child and a new role for you and your family. So prior to that, you have yourself and your partner, and you kind of know how you work together. You're like a puzzle. And you know what each person's responsibilities are and everything around life and how you manage. But then you have a child, and it's kind of like you are jamming this extra puzzle piece into the mix and trying to refigure out how everything works all over again. So I think just that, the complexity of that, along with the hormonal and drop and sleep deprivation, is just really hard for moms.
So is the go
Well,
ahead.
and I would say the issues that may have caused you stress prior to the birth of your child don't go away. Many people return to the workforce or have to finish school, or money's a concern, and that's only exacerbated when you have a new person in the mix.
So you mentioned partner. Do we? This is not neither a good or bad judgmental. Do we keep statistical information about single moms? Do we have a high single mom rate? We talked about poverty. I'm not associating that all poverty is associated with single moms or anything. But what about where you have just a mom and a baby? I see that a lot, just anecdotally. Is that an issue here locally?
Single parent households definitely statistically are chosen to have a lower income.
Okay.
So that, again, ties into so many socioeconomic factors that can be a challenge for any family. It could be education, it could be employment opportunities.
So you're focusing right now on the first birth, and then getting to birth, and then the first 1 or 2 years on this campaign, correct?
For this campaign, and again, we like to share, we are working with all these community partners under ABC Cayuga, but also through the health department, and we've been doing this for years, truly to get children ready for school and to be successful when they are in kindergarten, to get them into preschool, to get them services through early intervention if that's appropriate for them. There are so many facets and factors.
But this campaign is that first 2 years, which are vital.
I think the whole 0 to 5 is really what we're focusing in on. Nurse Family Partnership follows children until they're 2, but there are other programs such as Healthy Families is one of them that can follow a family until their child turns 5 years of age.
So 2 other items that came up in either in the brochure or something that you had sent me, I don't remember. One was the closeness in pregnancies. I guess I wasn't thinking about this. What is the issue there with closeness in pregnancy? And I'm not talking about Irish twins. Sorry, not running for president, so don't send me letters. But there's always I can say this too.
You can. I understand
Ms.
what
Donnelly.
that term means. Yes.
Okay, so, but that period where, it's 20 months or 18 months or whatever, what is the issue with health and closeness of pregnancies?
Maxine can probably speak better to some of the maternal health issues that can occur.
And that's definitely directly related to the premature birth rate. If if you have a child, if you become pregnant again within, I believe it's 1.5 to 2 years after you have your first, then you're more likely to have a premature birth.
And how about hypertension? I saw that on the list as well. Is that a big problem here?
It is. It is. Hypertension amongst pregnant women certainly is a serious health concern.
And so I'm going to get in my soapbox. I wasn't trying to do the math in my head. I think it's 53 years since the Surgeon General of the United States said that smoking, there's correlations and it's bad for you. We still have a problem in Cayuga County? If so, why? I mean, not that doesn't, you guys don't ask, you all, the health department in the state of New York, don't ask yourselves that why.
Why
Enlighten me. It frustrates me.
There's no perfect answer to that, and I feel the same way you do, and we could probably have a whole nother show to talk about
We might do this in the spring.
And electronic cigarettes and vaping and all that related. It's such an addiction.
We'll do that in the spring.
That would be really great, and it is an issue of concern that we have had put concerted effort toward because of the correlation between nicotine and tobacco use and premature birth. 17% of women in Cayuga County,
I believe so,
have tobacco use, have
at some
let
point
people
during their pregnancy or
70% of women who are
17,
pregnant.
17%.
Of women who are pregnant smoke.
Correct.
And the bigger number is much higher than that of those who are not
About
pregnant.
34% in our county. We have an incredibly high tobacco use rate within Cayuga County.
We have a few minutes left, and I would like to come back and talk about just your programs, but we're doing the global thing right now. But 2 quick questions as we continue. We talked about moms, we talked about babies. What's the role of dads?
Dads are an important part. When we talk about healthy baby, a healthy community, we really mean the family units as a whole. Dads are huge partners and proponents in helping the mom as far as being a support to their physical well-being and their emotional well-being, but they're critical in the family life and in supporting their family and being part of everyday life and care.
So from this campaign, we talked about how we want to get information out, and again, I apologize. 30 minutes, I told you 28 minutes goes very quick, and we did not get through a lot about the WIC program, which I'd love to have, the Nurse Family Partnership Program, or the Maternal Child Program, and there's some others, and we should do that in the spring, separate from vaping and smoking. What do you want the public to do? What's the public's role in this campaign?
Make the referral. Just call the health department. Call us. We're going to make a referral for a friend. Tell your niece about it. Tell your sister about it. Just call the health department, and we'll walk you through the steps from there.
So you mentioned insurance. If you have insurance, the county will try to bill that. If you don't have insurance, you're there as a mainstay of last resort.
We are there to help no matter what. Regardless of your economic ability, there is some service, some care, some education, some support that we can offer you and help link you into the community to help you fit in, to support your pregnancy, to support your family.
So what happens if I'm a mom and I'm on my second master's? I'm doing okay financially. Are there services there from the health department that I should be taking advantage of?
Absolutely.
So give me an example.
Yep. So, if that mom were to call us, they would have a conversation with one of our registered nurses, and we would just go through a general conversation and assessment with them together and talk about, whether or not they have some of those bigger needs, such as housing, food, things like that. But then it trickles on to the smaller things as well. And, talking about if they have a history of postpartum depression, it could be, and who they have to support them at home, and just how they're doing, and if they have any questions at all. And there have been situations like that where we have talked to moms and identified that there was a need and went right out to the home. And
you have visiting nurses, and
Yes.
that's all part of the services
That's
package
what's
that you...
unique.
Okay.
You got it. That's what's unique about the health department is we have registered nurses who can come to your home, and what a value they bring because of their wealth of knowledge that really supports the program.
Our guests have been Maxine Kinsella, who is with the Cayuga County Health Department, is the supervising health nurse, as well as Kathleen Cuddy, who is the director of public health, county health department, and the public health director for the county, to talk to us about the Healthy Mom, Healthy Baby, Healthy Community program that they're doing in conjunction not only with the county but several partners, including Auburn Community Hospital. I'd love to have you back in the spring. I'd love to have you back to just talk about all the other services there, and we can do that in the spring if you're willing. There's a lot to talk about here. We do encourage you to go online. You can call the health department, as we said, at 253-1560. I'll repeat that in just a moment to learn more about the Healthy Mom and Healthy Baby, Healthy Community program. But it is important that you do that. We need to raise the rates here in Cayuga County, and whether it's birth rate weights or getting babies to full term, or getting women not to smoke, we'll deal with that as well. But you can call the health department at 253-1560. We'll return in just a moment with a new edition of Beyond the Front Page with Dr. Linda Townsend, former Cayuga County Sheriff David Gould, and Vietnam veteran Nicholas Valenti to discuss Wreaths Across America, a program that is being celebrated next month, but you can also participate before that. Next Tuesday, we will have a city update from Mayor Michael D. Quill, who was just re-elected, as well as a discussion of Nick's ride with Cayuga County Sheriff Brian Schenk and Joel Campanella. And next Thursday, we have 3 shows, in fact. We will have an Owasco Lake update with Dr. Adam Effler, who I think works with you as well in the County Health Department, as well as Senator Pam Helming will be in for an Albany update. And believe it or not, we'll finish off next week with a visit from Santa. We'll finish up our fall 2019 season with former New York State Senator John DeFrancisco talking about his new book, Never Say Never, and City Manager Jeff Dygert. You can send us your ideas for future guests or shows at Inside Government or Beyond the Front Page. You can send those by email to cozguytho@aol.com, or Inside Government or Beyond the Front Page, 141 Dunning Avenue, Auburn, New York, 13021. I'm Guy Cosentino for Cayuga Community College. I want to thank you for watching. Hope you'll stick around for Beyond the Front Page to learn about Reese across America.